this is a blessing to our organization. It is a blessing to have an individual like Ann Miori, who is our horticultural therapist, to be associated with us, to have thought through this whole process across Bon Secours Charity Health System, and to design a garden specific to Good Samaritan Hospital for our needs, for our community needs, for our patients' needs, and every other thing. And for anyone who's ever picked up a flower, picked up a leaf during the fall, and noted something about it, I think that it resonated with you at a soul level to know that there's something very special about things that grow. We had a great groundbreaking ceremony earlier this week on Tuesday, and we were talking about spring and how things grow from the ground and how important that is to us. And what better thing to see today than to see our garden of hope.
So our garden design really, as Deborah said, is really site-specific to what we need here, our patients need, what our staff needs. When I was approached with this project, we really, Claire and Howard talked about caritas and what this means. And what it does mean is really, taking care of ourselves so that we can better take care of other people. And, I'm a plant person, but I'm really a people plant person, and this type of garden was designed specifically so that our staff, our patients, our community members in the spirit of Rockland could really, and throughout the community really, could come here and develop relationships with plants, with each other, and really get to know each other, learn how to care for each other. We have lots of different kind of design details that were worked on by the gentlemen at Teisch Garden Systems, Jamie Friedman and Mark Teisch. We have a wheelchair pedestal bed, planting bed, so that our patients in wheelchairs can stroll right up and do their thing. It is fully irrigated on 4 or 5 different time zones, I believe, irrigation zones. We have demonstration tables and planting tables that are mobile. We can move out of the way. A living wall, which enables our patients and us to kind of just really physically go and interact and be the plant, which is kind of cool. The raised beds are really a primary feature here, so that those that we invite into the community, from the community to join us, have an easier time at gardening. So it is a pleasure to garden, and we don't have to, get down there and dirty. And our staff can come out during, lunch hour and just kind of poke around and enjoy and breathe and rejuvenate.
1, 2, 3, snip.
Woo! Good. And now in closing, we would invite you to tour and also to plant seed.
It's an unfortunate truism that we're often cruel to each other. Sometimes we're not compassionate, sometimes we're not merciful to each other, and God only knows. But God, in His mercy, provided us with an answer. He created us from the get-go in the Garden of Eden. So we know that there was an outlet, there was a perfect space in which we can always return, to which we can always return, regain that primal state of peace before there was the separation. So in our pain, we look back to that moment, that Garden of Eden experience. In our pain, our separation from each other, we try to, once again, unite with each other. Now, God said to Adam and Eve, you should live in the Garden of Eden, Avdallah Shamra, to work it and to guard it. So we all need to learn how to work with each other and to guard each other as well. And there's nothing more healthy, perhaps, nothing healthier whatsoever, putting your hands in the loamy earth, touching it, getting a sense of the warmth of the soil, getting a sense of the seeds growing inside of them, understanding Adam and Eve all over again from the get-go. May God grant us all comfort, blessing, and peace, and may we enjoy well-being.